Okay. Hey everybody, my name is FaDima Keita, and with my presentation, is my public health issue I'll be talking about is the growing problem of dental fluorosis. So before I start off with my presentation, I would just want to define and inform y'all what is dental fluorosis. So what is dental fluorosis, you may be asking? Dental fluorosis is a disorder that usually affects children up to the age of 6 and is brought up on by excessive fluoride exposure during the period when teeth are developing. So it shows up as eroding and discoloration to obvious altercations in the enamel. So dental fluorosis affects smiles, aesthetics, and can cause psychological distress. It's making it also a significant public health issue. This degree can vary, of course, but it impacts on a person's quality of life and self-esteem from minor cosmetic problems to more serious enamel erosion. So the purpose of my presentation is to examine dental fluorosis origins, effects, and public health measures. We will have a thorough grasp of the problem and the initiatives being taken to solve it from a perspective of a public health by the end of this presentation. So dental fluorosis, what are the types? There are 3 types. There is mild, or call this light, moderate, and severe. So light is dental fluorosis, and light or mild instances manifest as hardly perceptible white streaks or spots on the teeth. So with this slide, you will see a picture, 3 mouths. From the left to the right, you can see as it light, the middle being moderate, and the right side being severe. So with the middle one as moderate fluorosis is when the teeth surface could be rough and they might seem brownish. So as you can see from the picture, like I said, from the light and moderate, you can tell that the teeth looks different because with moderate, you can actually see the dental fluorosis because of the teeth being from white to being brown and stained. With the light, you can barely see it. And last but not least is severe. And the severe fluorosis can have practical problems in addition to being as aesthetically disfiguring and with severe, as you can see, the teeth look like it is right. Causes of dental fluorosis. There are these causes that I put down are the most known causes. So fluoride water is one. To prevent tooth decay, fluoride is added to drinking water in many places. Although this is normally safe and effective, overexposure can occur in places where the water naturally contains high levels of fluoride. Dental supplies. Mouthwashes, toothpastes, and other dental supplies with fluoride are used to enhance oral health. However, overexposure can be caused by mishandling young children ingesting toothpaste and using products with too much fluoride. And last but not least, another cause is dietary sources. Foods that we eat, foods and drinks that we eat include tea and fish have naturally high fluoride content. Overindulgence in certain foods may also increase the amounts of fluoride taken in general. So the role of fluoride water in dental health. So the addition of fluoride to community water supplies at optimal amounts to prevent tooth decay is known as fluoridated water, a public health measure. Dental fluorosis may result from naturally occurring fluoride levels in some groundwater sources that are already beyond advised thresholds. The combination of naturally occurring and artificially added fluoride in the water supply can lead to overexposure to fluoride. And right here, as the next slide, you'll see that it's a chart of the different states in the U.S. And with these states, it just shows the percentages of fluoride. And as darker the states is, there's more fluoride when it comes to our underground water system. So as you can see, Georgia, where we're at, the fluoride is at 75 to 100% in our groundwater. And as you can see, more on the east of the U.S., the fluoride in our water is very high, more so what's on the west side, because west side is lighter shades of blue. So public health initiatives, keeping an eye on and controlling the fluoride content in drinking water. So in order to maintain the fluoride levels in drinking water within safe and ideal ranges, public health authorities periodically monitor and control the levels. By finding a balance in fluoride levels, the objective is to avoid dental fluorosis as well as tooth decay. Another health initiative is awareness of oral health is campaigns and educational activities that promote oral health and the dangers of dental fluorosis that are examples of public health initiatives. These ads promotes using fluoride containing dental products as prescribed, which is practicing good oral hygiene and being aware of the fluoride levels and local water supplies. So with the next slide, I actually found a case study of successful initiatives when it comes to dental fluorosis. So the location is actually in Harmony City, Minnesota. And the issue was a disconnect between the public health department and local dentists that was affecting the diagnostics and treatment of dental fluorosis cases. However, during the problem, there was a solution that came out, and the solution was a collaborative initiative that was established, fostering partnerships between public health department and local dentists, lead to diagnostics and treatment of fluorosis cases. And the result is early diagnosis and effective treatment, leading to improved patients' outcomes and a decrease in the number of severe dental fluorosis cases in Harmony City. With my next slide, I'll be talking about the modifying fluoride levels in drinking water. Okay, so the method for changing fluoride levels is a process of regulating the quantity of fluoride components in community water sources, include a methodical addition to removal of such compounds. So right here, with the next slide, I have a flow chart. And with this flow chart, it just shows how the process with the groundwater when it's from the fluoride contaminated wastewater to precipitation fluoride solids. So it starts out with the fluoride contaminated wastewater, and with that, it goes to fluoride precipitation. With the fluoride precipitation, it takes to a process with the ceramic UF, and with the ceramic UF, with this process, it removes the fluoride, and with the fluoride, they just put it to the side before I remove water. So with the water that is still contained with fluoride, it goes to the filter press. And with the filter press, it goes to the precipitation fluoride solids. So pretty much without the ceramic UF, if this flow chart, that's like the main thing that helps to remove the fluoride water. And some controls of it is the self-cleans and maintenance performance, the operational intelligence, and lowers OPX and FUS. And with the OPX and FUS, those are tools that are used in the dental office. And with the dental office, those tools are just used for the water. So, we go to the dentist, they do like a cleaning on you. The water is a tool that could, with the water that contains fluoride, and with the fluoride, they usually use it just to rinse out any bacteria or anything that's in your mouth. So in my next slide, I have solutions. So solutions, some several societal and individual level strategies can be used to reduce dental fluorosis, particularly in locations where drinking water fluoride levels are high or come from other sources. These are the following tactics. So some solutions are public awareness and education. To increase public knowledge of dental fluorosis, it causes and prevention, start public health initiatives. So we have to or people to teach communities the proper use of water and dental products with the focus on young people. So the next solution is modifying the amount of fluoride in drinking water. We have to work together with the local water authorities to control and modify the fluoride content of community water sources so that it stays within safe and ideal values. And another solution is utilize different water sources. In places where the water supply naturally contains high amounts of fluoride, promote the use of water filters or bottled water, limit your exposure to dental products. And to limit exposure to dental products, with the fluoride is to encourage sensible use of mouthwashes, toothpaste, and other dental products that contain fluoride. The urge of parents to watch over the kids, to instruct them, and not to ingest toothpaste. So I feel like with all these solutions, we have to really inform people. But in order to inform people, we have to inform ourselves with public awareness and education, because it's just so important for us to understand and know, like, we have to know dental fluorosis and how it's just so common. It's just common with the water we just use. We use it to brush our teeth, taking a shower, and then with the foods we also intake. So if we know the information and we like can understand and the solutions to use to know for dental fluorosis, we can also inform and teach other people and to help them not to have the dental fluorosis impacting them and just to save people. Okay, so here's some takeaways of the presentation. In summary, treating dental fluorosis necessities are a good strategy, and it's a very complex strategy. So this includes controlling the amount of fluoride in drinking water, encouraging the use of water sources, and arguing the appropriate use of dental products are particularly for young children. Because like I said it from the beginning, this starts off with young kids just being 6 years old. So effective case studies, community involvement, and public education are essentials for reducing dental fluorosis while preserving the advantages of fluoride for dental health. And by striking a balance between the advantages of oral health and the risk of fluorosis, these tactics enhance the general well-being of communities and people. And here's some of my discussion questions. I put down 3. So my first discussion question is, what are dental fluorosis and what are its main contributing factors? My next question is, what ways do you believe education and public health initiatives affect behavior and increase knowledge about dental fluorosis and how to prevent it? And last but not least, my last question is, what effects can dental fluorosis have on a person's general health and oral hygiene? Here are my sources. And thank you so much for listening to my presentation on dental fluorosis. And I hope y'all all have a good one.